Life is like photography. We develop from the negative. Differential diagnosis. Appearance is similar to other rashes that occur in skin folds, including Candida in Trigo. Frequently affects the woman. Rash may involve scrotum and penis in males. Erythrasma, it lacks an active border and demonstrates coral red fluorescence on Wood's lamp examination, which this disease do not have this feature. Inverse psoriasis manifest in other area of the body also, so we can differentiate from seborrheic dermatitis, sometimes called psoriasis dermatitis. It presents with the greasy scales on an erythematous base. Contact dermatitis also mimic that. So here one can see Candida intertrigo, erythrasma, and seborrheic dermatitis, inverse psoriasis in the folds, and contact dermatitis with the history of contact with something which is causing the problem. Now, coming to the treatment of the disease, treatment is of three types. Number one, general measures. Number two, topical treatment. And number three, oral or systemic treatment. First of all, the general measure, wearing the cotton underwear and the socks, keep the groin dry, and using the antifungal powder so that not providing the good soil for the fungus. Number two treatment is topical treatment. Antifungals topically target the synthesis of the ergosterol, a vital component of the fungal plasma membrane, so the fungus can't grow if that ergosterol is attacked. Topical therapies are effective and usually preferred, and one have to get rid of the jock itch because that is very much troublesome for the patient, as one can see the pain and wincing from the diagram. Now, continuing the treatment, topical treatment is available as creams, lotions, or powders for uncomplicated Tinea Cruris, and topical antifungal medicines are lilamine, which include terbinafine, butanafine, and naftifine, and the other group is azole group, which contain clotrimazole, miconazole, sulconazole, oxyconazole, econazole, and ketoconazole, all with ending zole are the azoles. These are prescribed once or twice daily for 2 to 4 weeks. Tolnaftate, by the name of tinectin, is a drug of choice among all these drugs. It relieves symptoms within 3 days and continue till all the signs are gone. Here one can see butanafine and terbinafine, naftifine, clotrimazole, miconazole nitrate, and sulconazole nitrate. And continuing topical treatment, alamines have a shorter treatment time, that is for being used 1 week. They are quicker insert and lower relapse rates. Their metabolism is independent of cytochrome P450 system, so do not have much interaction with the other drugs. Azoles require a longer treatment of duration, and newer topical azole, luliconazole, requires only once daily application for 1 week, and cycloperox olamine has a unique mechanism of action, and it has been underutilized antifungal medication, though in my personal experience it is very good and drug of choice among these are medical, which are being used topically. Use of the topical steroids plus an antifungal is unclear but might be having greater cure rate, and effect of the Whitefield ointment is also unclear. Here one can see oxyconazole as oxystat cream, econazole, ketoconazole, tolnaftate, and leuco, leuconazole cream is a new drug, and cyclopiroxolamine, which is also having unique action. So here is the person who is not having the two hands and he is writing with the foot to use as his hands. It is really a marvelous effort and it should be encouraged and appreciated. Now, continuing the treatment of Tinea Cruris, oral treatment is the third part of the treatment. That is, if symptoms persist or condition worsens, and for the chronic recurrent infection, systemic treatment is used. It is also for extensive or diffuse rashes and immunocompromised patient in dry, recalcitrant or refractory infection caused by the Trichophyton rubrum. Also need systemic therapy, and keep in mind that stratum corneum penetration and concentration maintenance and the keratin adherence and the patient tolerance are necessary for the systemic treatment. A minimum drug interaction is necessary for the ideal systemic medication, because if the patient is using other medicine, there is chances of drug interaction. Crisofulvin, itraconazole, fluconazole or terbinafine can be used. So here one can see terbinafine tablet, crisofulvin tablet, fluconazole capsule and itraconazole capsule. These are available as part of oral or systemic treatment. Relapses are common with crisofulvin and itraconazole 200 milligram twice a day for 1 week, and fluconazole 150 milligram once a day weekly for 4 to weeks are very effective treatment, and its cure rate is about 74%. Terbinafine is superior to the crisofulvin, and fluconazole have poor keratin adherence and prolonged treatment duration is needed. And similarly, crisofulvin is similar as fluconazole have certain limitation. Same is that with the crisofulvin. Due to its hepatotoxicity, oral ketoconazole is not preferred, and nystatin is not effective, or one can say ineffective. Now, topical antifungal therapies can be used as an adjunct or in combination to the systemic treatment. Combined topical corticosteroid and antifungal therapy remains controversial, and steroids improve the acute inflammation and itching but make the dermatophytes plasma membrane ineffective for the systemic antifungals and also for the topical antifungals. Tinea incognito is another complication of giving the steroid, and systemic plus topical antibiotics is being used to treat if there is secondary infection. Now, one can see before treatment the rash is there, as one can appreciate the margin and redness, and after the treatment one can see the clear skin and no rash. Now, Coming to the prevention of the disease, dry the area after bathing and use the separate towel. Decrease the moisture by using powder and loose clothing, so having proper aeration of the area. Treat all the areas simultaneously to avoid the reinfection from that not treated area. Put on socks first while changing the clothes. Put on socks first before the undergarments to avoid the direct contamination, and use the undergarments made of 100% cotton so that can absorb the sweat. Treat any fungal infection of feet or the nails and avoid the tight clothing. Losing weight if the person is obese is also important. Now, here are the preventive tips and home remedies of the Jock itch. Groin itch, one can see, wash the infected area properly, properly dry the area, and then apply the antifungal powder and keep the infected area dry and clean. So these are the tips by which one can avoid the infection. Similarly, use the 100% cotton made undergarments, or one can see the bar which is Terrasil, and it is antifungal cleansing bar or in place of the soap. Similarly, antifungal powder and the lotions and that contain clotrimazole, miconazole, terbinafine or ketoconazole, and these are the OTC product. One can have it from the counter, and their aim is just to treat the infection topically. Now, home remedies for the Tinea Cruris or the Jock itch, that sometime tea tree oil, put a few drops of the oil on a cotton ball, gently press it on the affected area, allow the oil to dry on its own, and follow this remedy twice daily for a few days until your symptoms disappear. If you have the sensitive skin, so dilute it 10 to 15 drops of tree oil with 2 tablespoons of vitamin E oil, coconut oil or any other vegetable oil, and then apply, and that is a very good, said to be the home remedy. And here one can see the Selsun blue that can also be used. Aluminium salt is sometimes being used. Vinegar is sometimes also being used as home remedy. Now, coming to the prognosis, Tinea Cruris is not life-threatening and the treatment is very effective. Patients with the Tinea Cruris who undergo an appropriate treatment course and experience 80 to 90% cure rate if properly completing the course of the treatment. Recurrence may occur. The intense itch may lead to the lichenification and secondary bacterial infection of the affected skin. Irritant and the allergic contact dermatitis may be caused by the applied medication. And that is the end of the lecture. I hope so you may like it. And if you please like it, just subscribe my channel and share it with the others. I have given a complete comprehensive account of the disease and hope you will enjoy it. And thank you very much for watching and to be with me.